Hello everyone, I am Karen Isabelle Torres, and I will be presenting the 6 refractive conditions discussed in theoretical optometry, namely myopia, hyperopia, astigmatism, amblyopia, anisometropia, and presbyopia, since it is not considered as a refractive condition. Starting off with myopia. Myopia is also termed as nearsightedness. It is a refractive condition characterized by blurring of vision at far or at distance and is corrected by minus lenses. This happens when the distance between the cornea and retina is too long, therefore bringing the focus in front of the retina. Myopia usually occurs in children, especially students, for they are the ones most exposed to near works, especially schoolworks. Signs and symptoms of myopia are blurring of vision at far, asthenopia or eye strain, squinting of the eye and long staring expression, protruding eyeball and exophoria. Possible risk factors of myopia are family history of myopia, against the rule astigmatism, usually in children with steep corneal curvature, decreased accommodative function, and substantial amount of near work. Treatments for myopia are optical correction such as using of spectacles and contact lenses, taking of medical or pharmaceutical agents for pseudomyopia, orthokeratology, lastly, refractive surgery. Second refractive condition is hyperopia. It is also called as farsightedness. It is a refractive condition characterized by blurring of vision at near, and due to the short axial length of the eyeball, the image is formed behind the retina. It usually occurs in infants because their eyeballs are still developing, but they become emmetropic at the age of 6 to 8 years old. Signs and symptoms of hyperopia are blurring of vision at near, asthenopia or ocular fatigue, accommodative dysfunction, strabismus and amblyopia, squinting when doing near activities, and learning problems in children. Treatment for hyperopia are optical correction, vision therapy, taking of medical or pharmaceutical agents, modification of patients' habits and environment, and refractive surgery. Astigmatism is a refractive condition in which the eye's optical system is incapable of forming single focus on the retina. It is characterized by blurring of vision at far, near, or both, due to the irregularity of the shape of the cornea or the corneal curvature. Signs and symptoms of astigmatism are asthenopia or eye strain, unnatural ocular posture, and basal headache in oblique astigmatism. Main treatment for astigmatism is putting on minus cylindrical lenses. Presbyopia. Presbyopia is an age-related visual impairment which results to the inability of the lens to accommodate due to the weakening of the ciliary muscles. It is not a refractive condition, but it usually occurs in patients who are 40 years old and above, though some may experience early onset of presbyopia at the age of 38 to 40 years old. Those who are involved with presbyopia are said to be more demanding in near vision tasks and cannot work without the aid of optical correction. Risk factors of presbyopia are age, hyperopia, occupation, gender, ocular disease, systemic disease, drugs, and geographic factors. Common signs and symptoms of presbyopia are blurring of vision at near, insufficient accommodative ability, ocular discomfort, ocular fatigue, and diplopia. Treatment for presbyopia are optical correction with spectacle lenses, contact lenses, or combination of both. Amblyopia is a loss of visual acuity that cannot be improved by corrective lenses. It is also called as lazy or blunt eye and is most common in children. Causes of amblyopia are difference in sharpness of vision and strabismus. Signs and symptoms of amblyopia are eyes situated outward or inward, poor depth perception, inability of eyes to work together, and squinting. Treatment for amblyopia are eye drops, and vision therapy such as eye patching. Anisometropia is a condition in which the eyes have relatively different conditions. One may be higher or lower, or the other may be myopic and hyperopic. Causes of anisometropia are binocular anomalies, unilateral ocular pathology, lid pathology, retinal pathology, and surgery. Common signs and symptoms of anisometropia are asthenopia, blurred vision, headache, diplopia, squinting, covering of one eye, tilting of head, excessively close working distance. I hope that you enjoyed this video. Thank you for watching. Bye!